My name is Adrian Yeager. This is my proposal to reduce suicide rates in men in rural communities by 15% over the next 5 years. The public health problem I chose to research was the high suicide rates among men. The importance of studying this is because suicide is a leading cause of death for men between the ages of 15 and 44. This accounts for 78% of all U.S. suicides according to the CDC in 2024. A few reasons why this problem is getting worse is primarily due to masculinity societal norms, which discourage men to express emotions and seek help. Another reason is because there is easier access to firearms and other weapons, which raises the risk of suicide and self-harm. Cost and limited mental health resources in rural areas also prevents intervention as well. Suicide is a serious topic and a very serious issue, with about 4 out of every 5 men committing it in the U.S. each year according to the CDC. The issue is that mental health disproportionately affects men living in rural areas, veterans, and middle-aged individuals. The main reason is that there is higher firearm and weapon access in rural areas, as well as a lack of mental health services. The source of this issue can primarily be seen in depression and substance abuse cases. Without an early intervention, the risk factor elevates, which ultimately leads to those attempts at suicide and self-harm. Research suggests that mental health conditions such as depression and substance abuse significantly increase suicide risk in men, according to the CDC. Another factor is access to weapons such as firearms, which increases the death rate of suicide attempts. According to the World Health Organization, studies show that interventions which target stigma and access to mental health care significantly reduces the suicide rates. There are 3 potential interventions that may work to help reduce the suicide rate. The first is the primary intervention. This intervention aims to use campaigns to reduce the stigma around mental health in men. The advantage to this is that this type of intervention is one that raises public awareness, targets social norms, and fosters help-seeking behavior. A disadvantage is that the change may be slow, and the effectiveness all depends on cultural adaptability. The second type of prevention is depression and suicide screenings in the healthcare setting. This helps to identify the risks earlier and prevents the escalation of self-harming behaviors. The issue with this form of intervention is that it relies on health care and the consistent follow-ups. The final type of prevention is the tertiary prevention. This involves peer support groups and therapeutic programs. This type of prevention can build a community around mental health support, but the issue is that it is limited by accessibility and participant stigma. The way I chose to curate my intervention plan was to use a combination of all 3 intervention styles. According to the World Health Organization, educational campaigns effectively reduce stigma around mental health, which in turn helps to improve help-seeking behavior in men, while screenings for depression and peer support also demonstrate significant reductions in suicide rate in at-risk populations. One of these campaigns, which helped normalize mental health conversations, is the Are You OK campaign based in Australia. This campaign focused on inspiring and empowering people to connect with those around them by using 4 steps: asking, "Are you okay?" listening, encouraging action, and just checking in. The website gives helpful tips to people who are looking how to respond to somebody who says that they are not okay. It also helps with mental health resources, as well as guides on how to check in on those around you. Another campaign is the U.S. Veterans Crisis Line. This phone line and website has helped to give veterans a specific place to get help. This can be in depression, PTSD, or any other crisis a veteran may be dealing with. This campaign has helped to reduce the suicide risk among many veterans. My target is to reduce suicide rates in men by 15% over the next 5 years and focus on high-risk groups like rural residents and veterans. My proposal aims to reach men, focusing on the high-risk groups such as veterans, individuals in rural communities, and those facing economic challenges. Using the when, who, how framework, these efforts target men of all ages, beginning with adolescents and young adults, and extending to middle-aged men through ongoing support. This approach includes educational campaigns to encourage behavioral changes, free screenings to identify early signs of mental distress, and peer support groups to provide continuous assistance and connection. The effectiveness of these interventions will be evaluated using the RE-AIM framework, which focuses on reach, effectiveness, adoption, implementation, and maintenance. The target objective is to reduce male suicide rates by 15% within 5 years through these combined interventions. Success will be measured by reductions in suicide rate, increases in the number of men seeking mental health support, and improved mental health outcomes as reported in community surveys. This intervention aims to reduce suicide rates among men by improving mental health awareness, increasing early detection of mental health conditions, and providing sustained support through peer groups and therapy. A measurable reduction of approximately 15% in the male suicide rates is anticipated over the next 5 years. A few challenges include limited access to resources in rural areas, cultural stigma against seeking help, and maintaining consistent program funding. Additionally, variations in adoption rates and program effectiveness across different demographics may impact overall success. That concludes my proposal on reducing the suicide rates in men. Thank you for watching.